After several days of lower increases in COVID-19 statewide, our 24 case increase climbed back up today.
We're seeing slightly more new cases than recoveries tonight. This comes after several days of improving numbers. Looking at our hospital capacity, both available floor beds and ICU beds have dipped back below 20%. In Davidson County, active cases have dropped below 2,000.
But as News Channel 5's Kyle Horan learned, while that is good news, there's still more work to do.
Since the beginning of the summer here in Nashville, the cases have been dropping pretty steadily. Doctors say that this is good news for the amount of coronavirus that we have in the community, but it's not time to take the masks off yet. Every week since this pandemic started, Metro Public Health has been tracking the numbers. Since this began in March, we've seen peaks and valleys in the data. Right now, the trend is downward. According to Dr. Alex Jahangir, it's good news.
Those numbers translate to 19 cases per 100,000, where at our peak in July, we were at 65 new cases per 100,000 people. I mean, I'm celebrating the fact that we've gone down.
He says the only reason this has happened is due to social distancing and because of mask wearing. And while it's all hopeful, there's no guarantee the downward trend will continue.
We were really on a bad upward trajectory at the end of June, early July. And on June 27th, when we put in the mask order,
Dr. Jahangir would like to see COVID cases drop so the city can return closer to normal.
if we can go out more and do some events and go to sporting events and open up schools. I mean, my gosh, how many people, myself included, my kids are currently in the virtual setting, would love to go back and have our kids be back in school when it's safe.
Until there is an effective vaccine, though, he doesn't believe we'll see an end to this pandemic.
Even when there's a vaccine, until we get what's defined as herd immunity, so everyone in the community essentially has protection, there will always be cases.
Kyle Horan, News Channel 5.